Epipen. Who should be a candidate for Epipen?
Epipen is a device which administers epinephrine, adrenaline, in a subcutaneous fashion. By putting this pen-like device against the skin, a needle will very quickly inject into the skin a small dose of epinephrine. Epinephrine is a rescue medication for patients who have anaphylaxis. That is a severe allergic reaction which affects their breathing, their heart rate and blood pressure, or both. Patients who are candidates then for an EpiPen is any patient who's had one episode of this type of severe reaction. We do not give EpiPens merely for children who have a history of a food allergy or who developed hives from a food allergy. But if they developed a more serious systemic reaction which affects breathing or heart rate or blood pressure, an EpiPen can be given for that patient.
One of the nurses in a school, I won't mention names obviously, wanted the sibling of a kid who had a severe peanut allergy have an EpiPen in school. Does that make sense to you?
There's no indication to have an EpiPen for a sibling. The risk of developing allergies in general certainly does run in families, but the type of allergy and the severity of the allergy is very individual to the patient. And so if this patient had never had a serious allergic reaction before, there's no indication for that patient to have an EpiPen on this person.
I've had parents ask me, can I send the kid to the lab and see if my kid has peanut allergy before I give kid peanuts? That makes sense?
You cannot develop an allergy to a food that you've never been exposed to. You always have to have some exposure before an allergic reaction develops. And it's very common that patients will have had peanuts for a period of time before they develop their first peanut reaction. And so a blood test in a child who's never been exposed or who's never had a reaction before would not be predictive at all of whether future exposure would cause an allergic reaction to develop.
If a kid was having a history of a potentially anaphylactic reaction in the past, starts to get some symptoms at school, giving the EpiPen early makes more sense than later. Is that true?
If the patient has had a history of anaphylactic reaction in the past and they're starting to have even the mildest symptoms, using the EpiPen at the earliest point of time will clearly prevent those symptoms from worsening into a more serious event. So use it early if you suspect that a reaction is occurring if the history had been there.
Delay can be fatal.
It absolutely can be fatal. The other thing to remember is EpiPen is an emergency rescue medication. It's not a final treatment. The medication in EpiPen wears off in about 20 minutes, and at that point in time, the reaction can start up all over again. So once an EpiPen is given, it buys you time to then get your child or yourself to a medical facility to continue therapy if necessary.
And if you call 911 and they don't get to you with that period of time, it's good to have a second one just in case.
Yes, we should always have a second EpiPen available. It's routine for patients to have two so that if the first one doesn't work well enough, misfires, or just starts to wear off, there's a backup in place.
And they should be careful about the date because it wears out pretty quickly. Is that true?
Yeah, the expiration date on EpiPens is generally about 6 months, and so you need to keep track of the expiration date and renew your prescription when your expiration date comes through.
And the rule of thumb is, if you think this is going to anaphylactic reaction, do not wait, do not delay. And if you're not sure, make sure the pediatrician or your primary care physician shows you how to use it. It's not difficult, but it's a tremendous fear that first time. And after you do it once, it's not even a big deal.
Absolutely. The fear of using it the first time is much greater than the reality. Worst case scenario is if you use it a little too early, you'll get a little shaky, you might get a little nauseous. It wears off in 20 minutes. The benefit is that you may have protected against a potentially life-threatening reaction.
And we know that it's saved many, many lives because it has reversed the process. Is that true?
Without question.